Now we start scanning from suprapubic area by using linear probe, placing at transverse position. First we locate the urinary bladder, sliding probe downward. Here we see the urinary bladder. We see gas shadows on the urinary bladder, which are echogenic. Now sliding probe upward to locate the distal ileum. Here we see the distal ileum. The walls of distal ileum are prominent, shows mild inflammation. A hypoechoic layer, which is muscular layer, and echogenic layer is submucosal layer. This echogenic area is gases in the intestine. Now we slowly sliding probe to the right iliac region to locate the ileocecal junction. This part of the distal ileum is normal and the walls of distal ileum are not visualized, only gases are seen. Here we see an hypoechoic area between the gases. Now we will examine this hypoechoic area. When sliding the probe at its axis, we find out that these are two vessels, an artery and vein. These are common femoral artery and vein. Now slowly sliding to the right iliac region. These are gases. This is ileocecal junction and this is cecum. The walls of cecum are also prominent and thickened and inflamed. The submucosal layer of cecum are inflamed and more echogenic and prominent. It shows that the cecum is more inflamed, but the distal ileum walls are appears to be normal and not visualized. Now we're fixing the probe at this point and will tilt up and down side to locate the appendix. Here we see a hypoechoic cystic-like structure. Now rotating the probe at its axis, we see a lumen. containing fluid. This lumen is attached with the cecum. And this is blind end of this lumen. It seems that the appendix is inflamed and contain fluid. The walls of appendix are mildly inflamed and prominent, but appendix is distended with the fluid containing minimal debris. Patient is feeling severe pain at this area on mildly compression fact. Now we will check the surrounding tissues of the appendix for periappendicular fluid or collection. We see that no periappendicular fluid present, but surrounding tissues shows heterogeneous texture, hypoechoic and hyperechoic texture. Here we see the distal ileum lies above the appendix, which shows normal appearance. It shows that the appendix is lies posterior to the distal ileum. Now we are rotating the probe to take the cross-section view of appendix. For measurements of anterior posterior diameter, the anterior posterior diameter of appendix is 16.6 millimeter. Now we will Now how we will write report.